Duphalac syrup is a laxative. It has a laxative effect, stimulates intestinal motility, improves the absorption of phosphates and calcium salts, promotes the excretion of ammonium ions. Indications: constipation, regulation of the physiological rhythm of colon emptying, softening of the stool for medical purposes, with hemorrhoids, conditions after surgery on the colon and in the anus, hepatic encephalopathy in adults, treatment and prevention of hepatic coma or precoma. How to use: the drug is intended for oral administration as well as for rectal administration. Lactulose solution can be taken both diluted and undiluted. All dosages must be selected individually. It is necessary to immediately swallow the accepted single dose without holding it in the mouth. In the case of a single daily dose, it must be taken at the same time, for example during breakfast. During therapy with laxative, it is recommended to take a sufficient amount of fluid, about 2 liters, which is equal to 6 to 8 glasses per day. For accurate dosing of the drug in vials, use the enclosed measuring cup. When using the drug in sachets, it is necessary to tear off the corner of the sachet and immediately take the contents. Dosing the treatment of constipation or to soften stools for medical purposes. The usually daily dose of lactulose can be taken once or divided into 2 using a measuring cup. After a few days, the initial dose may be adjusted to a maintenance dose depending on the response to the drug. The laxative effect may appear 2 to 3 days after the start of the drug. Adults and teenagers. Initial daily dose 15 to 45 ml, 1 to 3 sachets. Maintenance daily dose 15 to 30 ml, 1 to 2 sachets. Children 7 to 14 years old. Initial daily dose 15 ml, 1 sachet. Maintenance daily dose 10 to 15 ml, 1 sachet. Children 1 to 6 years old. Initial daily dose 5 to 10 ml. Maintenance daily dose 5 to 10 ml. Children under 1 year old. Initial daily dose up to 5 ml. Maintenance daily dose up to 5 ml. If the maintenance daily dose is less than 50 ml, it is recommended to use the drug in vials. For accurate dosing in children under 7 years of age, it is recommended to use the drug in vials. Dosing the treatment of hepatic encephalopathy, adults, for oral administration. Initial dose 3 to 4 times a day, 30 to 35 ml, 2 to 3 sachets. Then they switch to an individually selected maintenance dose, so that soft stools are a maximum of 2 to 3 times a day. For rectal administration. In the case of a precoma or coma, the drug can be given as a retention enema. 300 ml drug, 700 ml water. The enema should be held for 30 to 60 minutes. The procedure should be repeated every 4 to 6 hours until oral administration becomes possible. Contraindications: galactosemia, intestinal obstruction, perforation or risk or perforation of the gastrointestinal tract, intolerance to galactose or fructose, lactase deficiency or glucose-galactose malabsorption, hypersensitivity to any component of the drug. With caution, the drug should be prescribed for undiagnosed rectal bleeding with colostomy or ileostomy. Side effects: in the first days of taking lactulose, flatulence may occur. It usually disappears after a few days. In the case of the use of high doses for a long time in the treatment of hepatic encephalopathy, the patient may develop disturbances in the water and electrolyte balance due to diarrhea. The immune system, frequency unknown, hypersensitivity, gastrointestinal tract, very common, diarrhea, often, flatulence, abdominal pain, nausea, vomiting. Skin and subcutaneous fat, frequency unknown, rash, pruritus, urticaria, erythema.